Hi, today we're going to be talking about medical marijuana uses. Medicine is such a wonderful advancement that's been modified and refined over the centuries. The world has really come a long way when it comes to how medicine is clinically tested and reviewed for usage to help patients. And the list of different medications and medical advances continues to keep growing over time, such as vaccines in 1796, anesthesia starting to be used in 1846, medical imaging in 1895, and even organ transplants starting to be done in 1954. But what about the 21st century? That is where medical marijuana comes into play. Medical marijuana became legalized in the US of January 2017, and after that it kind of got its own reputation of its common use for recreational use after the legalization. However, medical studies are being continued to do and have been done for people with medical conditions, specifically chronic medical conditions, and they're all coming to the conclusion that it is being effective. It is effective in treating certain patients with certain illnesses. First thing we're going to talk about is chronic pain management. Pain is usually the first sign of an illness, and it's usually the first symptom people get to get them into the ER. However, once they get into the ER or wherever, the first typical response into the symptom is opioid analgesics. However, opioids are known for their adverse effects, but when it comes to marijuana, once it is consumed into the body, it contains cannabinoids that bind to your neuron receptors in your body that over time result in decreasing pain with use. But when comparing the two with side effects, opioids are more known for their adverse side effects such as cognitive impairment, respiratory depression, and dependence. However, when it comes to marijuana, the side effects usually are not as severe and overall pretty temporary. Therefore, it is evident that for pain relief, cannabis does a thorough job in relieving pain with not as severe side effects or adverse effects. Next, we're going to go to something that people don't really think about much, which is the total medication usage. Additionally, marijuana is used to cover multiple symptoms, and in turn, allowing patients' ability to decrease the amount of medications they take. But when it comes to developing chronic illnesses, medications can rapidly increase for daily use to provide relief for different symptoms. As medications can help significantly, it is widely known that consuming several different types of medications can increase the risk of interactions and can have negative effects on your organs in the long run. This is where the use of marijuana can become beneficial to those who consume a wide variety of medications for chronic illnesses. When consuming cannabis, its effects have a wide variety of benefits, from helping to relieve pain to relieving nausea or increasing appetite for those who struggle. This in turn has been shown to be beneficial in this study that was done on both men and women. Um, all participants had chronic illnesses and were given a medical and marijuana card to be used regularly on their own, and the outcome was observed. So for those who had a reduction of prescription use, were pretty significant in the study group. However, compared to those numbers, even that those who had complete discontinuation of their prescription medications and reducing the total amount of medications needed were even more significant, from 62% in men and 80% in women. Finally, when it comes to individuals with chronic illnesses, quality of life is a very important aspect. Being able to live life as comfortably as possible with such severe illnesses is a struggle for many. As an effect, many turn to support for basic relief or any type of improvement in their quality of life, whether it be managing chronic pain along with other symptoms. Marijuana has shown through studies how it can be helpful in a wide variety of patients with pain management and even additional benefits of reducing the amount of medications. And then these are my references. Thank you.